The moment you walk into a job interview, the clock starts ticking.
And just like in clinicals, impressions form in seconds and they stick.
50% of employers decide in the first 5 minutes if you're a fit.
And a third make that call in just 90 seconds. Before you ever even finish your introduction, they've already made a judgment.
This means that your clinical personality from last week's episode doesn't just vanish. It follows you around right into that interview room. And it could even decide what floor you might thrive on the most.
So today, we're breaking down how each of these personalities can either help or hurt you when you're trying to land that first nursing job. This is the Nursing Navigator.
Nursing Navigator's here. Wipe away those study tears. Hurst Review's got your back. Listen close, stay on track.
It's important to understand that hiring managers aren't testing your knowledge. They are silently asking you, do I trust this person with patients? Are they going to be safe? Do I want them on my team at 3 a.m. when things hit the fan?
It's important to remember that students who built positive reputations during their clinical rotations were significantly more likely to receive job offers from their sites.
AG, let's talk about the audition.
Oh, gosh. Okay.
Because your interview is your next audition.
Yeah.
Last week, we talked about 3 different personalities. We gave them the names of the golden retriever, the wallflower, and the bold beginner, and shared how they would present in a clinical setting. But we know the interview, to land the job, to become that brand new nurse, your personality is also going to come through. So tagging on to those 3, how would those present in an interview type setting? But then also, are there certain floors or career paths when they're interviewing that certain personalities will shine a little bit more in that environment?
The first one is the golden retriever. And some of the things that we said about the golden retriever is that they are very eager to help. They like to sometimes just jump in. They want to, be so helpful that sometimes they don't read the room and they jump in before they should. Sometimes they overtalk or overstep certain boundaries just because they are so very ready to help, and they don't always ask for permission when this happens. And we know that if during an interview, if we're doing this, we may overtalk the interviewer. Mm-hmm. The interviewer is trying to ask a question, and we're just already finishing their question for them instead of just waiting to find out what the question fully is. We may offer more information than is necessary just because we're trying to be helpful, but we're also trying to help ourselves in this interview process. So we may overtalk.
Which could potentially do some damage.
Oh, yeah.
With the oversharing.
For sure. And, sometimes during an interview, your eagerness can sort of come off as being a little desperate. And we don't want, it to appear that they're being just so overly eager for this job. We definitely want people who, want to work and want to be a nurse, but sometimes we got to read the room just a little bit better.
And what we talked about last episode too is body language. Yeah. So body language is really important when going into that interview type setting, because we know that people are already starting to make those judgment calls. So with the golden retriever, they're likely to walk in with a big smile on their face, shake everybody's hands, sit down and have that really warm and inviting energy, which is awesome. But we want to use that open posture and a steady tone for the golden retrievers. And part of that body language, like you said, is wanting to finish somebody's sentence. And we can get ahead of ourselves in those moments. So maybe a good tip for golden retrievers when they're interviewing is to have that strong presence, but to stay steady. Mm-hmm. Take a deep breath, listen, and allow the person to finish speaking or asking the question before providing an answer.
That's right. I think we also need to be able to channel some of that enthusiasm, maybe into collaboration, especially in the form of a story. I think sometimes one of the biggest answers that the golden retriever likes to give, and they don't only give it verbally, they give it with their body language, is that I just want to help, is that I'm a helper. I love helping. And instead of saying that, maybe give an example of how you've helped before. Say, this is a time where I showed up and I helped my team accomplish blank. And
That's
this
a
is
really
how I
good
did it.
tip.
Yeah.
And it shows, I think that shows a next level of emotional intelligence as well, which is pairing that confidence with excitement and being able to take a step back and analyze the situation before just jumping in or maybe asking for that permission that we talked about.
Yeah.
And emotional intelligence is really big when it comes to the nursing world, but also how can you show those examples of having emotional intelligence in that interview process?
I think brand new nurses too, they don't always feel like they have the experience because, they've not worked in a hospital setting as a nurse before. And so they're like, well, where do those experiences come from? Like when I'm in an interview, what am I sharing? Because I don't have the experience as a nurse. Well, that's why nursing school is so important. Clinical is so important. Lab is so important. What have you done in those environments? Because that is going to be your evidence. And that is perfectly fine to share that evidence too.
And that counts as experience.
It does.
That's why it's built into the program the way that it
That's
is.
right.
The over eagerness in clinicals for the golden retriever is something that they can bring to the table when they're sharing their experience as, hey, I have really high initiative.
Mm-hmm.
And I want to explain that. I want to show that. And I want to prove that during this interview process.
That's right.
I really like the example question that you provided. And next week, we're wrapping up this clinical personality little series. We're actually going to get into the most frequently asked questions that you can expect in that nursing interview. Then we're going to provide you with a very matter-of-fact, detailed outline on the best ways that you can answer those questions. But I think it's important that we lay the groundwork first so that way you can understand your personality before we get into practicing those responses. When it comes to the golden retriever placement, knowing those strengths, are there certain areas within nursing that you're like, yep, this is a wonderful career path for our golden retrievers?
All right. So their warm nature and their willingness to help. And, I think sometimes people view the personality of the golden retriever as fun. And so automatically I'm thinking pediatrics.
Yeah, me too.
Because
that's the kind of nurse I would want, like going back to like children's hospital.
That's right.
Setting, like, and it's a golden retriever. Like, hello, dogs. Right. Kids love dogs.
That's right. And so like they're, like we talked about, they walk in with a smile. Kids need that. Kids love that. And I think that they're more willing to understand the idea of play, which is how children learn. So I think pediatrics would be a great environment for them. Another really good environment maybe would be public health or community health, just because they're engaged and involved with lots of things that are going on in their community. One of the things that I feel might be missing from nursing a little bit is that patient education aspect. And, we're all called as nurses to educate our clients. We're supposed to do that. But there's just some people that do that a lot better. And I think that the golden retriever personality does. Their willingness to help, their willingness to jump in and inform people.
And they tend to be approachable.
Yeah.
Right? And so the non-nurses who are seeking that education and information, nobody wants to be in that position where it's like, I'm too scared to ask, or I should know this, or maybe somebody told me this answer already and we were dealing with a million other things. But the wonderful thing about these golden retriever nurses is that they are approachable and understanding, and, they have that likability to them that makes it easier to go to. So I think that like positivity aspect of it and approachability is also really awesome for those like educators.
Right? There might be a slightly forgotten area of nursing, and it's case management. And so I think that their positivity and their willingness to help may really help here too, because this is helping people get some of the things that they need, maybe some forgotten or not thought of things that they need for their care. And so just helping to coordinate all of those aspects of care, they might be really good.
I can totally see that because
Mhm.
as a patient, I have been told you need to advocate for yourself when it comes to your health, which can be really intimidating at times. But I'm glad that you brought up case management because we haven't really talked about it.
Right. And sometimes patients don't even know, like they don't know where to start. They don't know what questions to ask. They don't know what resources they need, and they don't know what resources are always available to them. And that's where the golden retriever can really shine because they know, and they're not afraid to go and find it. They're like, I got you. I'm going to help you. Let me go get what you need.
And they're probably well liked by the
Yeah.
other departments that they have to go to. So
That's right.
that's just the best person to have in your back
For
pocket.
sure.
Anything else?
Their personality traits just make them the most excellent leader. Because, when we think about leadership, we definitely think about having the ability to lead, having the ability to make hard decisions. But something that gets a little bit lost is how much do you like me and how much do I like you? Having a leader that you like and respect and is a joy to be around, that's fun. And so in nursing, you want leaders that you enjoy being around and enjoy working with. And their personality really helps with that.
I can see that for all three of these.
Yeah, for sure.
Too, because it's important to have that diversity when it comes to leadership.
Yep.
Yes, you want somebody that can be liked. Also, there's the silent leaders,
Right.
Which falls into our wallflower category, which we'll get into. And then sometimes you just need a really strong leader who's going to get it done.
That's right.
And that's probably going to be your bold beginner.
Yep. The decision makers who aren't afraid to ruffle any feathers, but get it done in the right way.
Speaking of bold beginners, how might those confident and high initiative, overachieving personalities that we've seen in clinicals show up when they walk into that audition room, the interview room, and say, I want to be a nurse at this hospital?
Well, they definitely do all of that. They bring that confidence, that leadership potential, and that initiative with them. But one of the other things that we might see is some of those same things we saw at clinical, where they know it already, or they have a certain way that they do it already. And so they might not be as open to some of the things that are being said during the interview. They might not feel like they have weaknesses. So that's a hot interview question, right? Yes. It's the one we don't like.
What are your greatest strengths? What are your greatest weaknesses?
Like, I don't have any weaknesses. Well, we all do. And they might downplay some of those things that are weaknesses and, not even try to mention those during the interview process. And so we don't want to come off as arrogant or cocky during the interview process. We want to, make sure that we have that humility that we bring during that process too. And so they may accidentally have that show up during their interview.
Yeah. Maybe one thing for bold beginners is to pair your confidence with curiosity.
Yep.
Because curiosity in an interview is a really good strength to show. Yes, interviews are weird. They're awkward. You are speaking about yourself a lot. But to be curious is to ask the interviewer or interviewers, if there's multiple, about their experience and how do you see how things function when it comes to XYZ.
That's right.
So it's okay to kind of reframe and ask questions back. You don't have to wait until the end when they ask you, do you have any questions for us, which is pretty standard. Feel free to pair that confidence with curiosity. And you can say things like, I've had experience with fill in the blank, but I'm eager to learn how your team does it or how your hospital does it. Because that shows them that you've had experience and you know what you're doing, but also that you're willing to adapt and to be a team player.
You never know. I think when you change what you think you know into a question, you might actually learn something that you didn't know. Like they might tell you something that you weren't aware of. And so don't be afraid to do that. And people won't know, like it won't come off as, I already know everything.
Yeah, and we talked about this last week. Sometimes those bold beginners, they know how to do it, so they just go ahead and do it.
Mm-hmm.
And a really good interviewing tip, at the appropriate time in the appropriate setting, it's okay to ask a question that you already know the answer to. You don't have to let them know that you know the answer to it. But again, it kind of invokes that humility aspect of it, because the strongest leaders are confident, which we know our bold beginners are, but they're also teachable.
Yep.
And by showing that you're curious and that you can put your ego aside and be, practice humility, that's where that teachable leader comes into play.
So when it comes to placement or career path, we can definitely see them as managers. And so anything in management, preceptors, charge nurse, patient care coordinator, any of these leadership roles. I mean, even possibly the CNO, chief nursing officer at some point. And so definitely have the potential and the leadership capabilities for that.
So that's long term. And it's great to have that plan going into it. And you can never start early enough. You can never start too early. It's never too early to start, is what I'm trying to say. But what about that first step?
That's right. Bold beginners, I'm thinking bold career paths, fast paced, ER. We know we've got to, and this is a situation where in an ER, you are sometimes making decisions that are not step 1, step 2, step 3 decisions. You are assessing the situation and then doing something based on that. And so I think an ER setting would be great for them, especially with all the different types of issues that clients can come in with, diagnoses that the client can come in with. It's always something new. It's a different day every day.
They probably like challenges.
They do.
Too.
And that's going to be a great challenge for them because they're going to sometimes have things that they've seen a million times. And then one day they're going to have something that they've never seen before. And it's going to be something to try to figure out. Another one is the twin, ER's twin, ICU, any of the ICUs. And so then they, have their pick of, well, what type of ICU do I want to work in? Again, that fast-paced, not the same thing every single day, challenging, because they may be on a one-to-one, but that client has a lot of things going on, a lot of things to manage for that client. And so I think that would match their personality really well too. All right, and then with that, self-starter, high initiative, bold beginner, I think travel nursing is a really good one too.
Oh, we haven't really talked much about travel nursing either,
right.
other than the flexibility that it brings.
Right.
But I could totally see that.
Yeah, I mean, you're in a different environment. You probably didn't get very much of an orientation, if you got any at all. You are out there kind of on your own and you're trying to figure it out. And I think their personality is perfect for that because they are up to the task. They are up for the challenge and they know that they can do it. And the truth is that they can. And so I think travel nursing is really good for them too. Once they get a little bit of experience, in any area that they've chosen to go into, travel nursing might be perfect.
And it would give them all that additional experience in different healthcare settings for that long-term goal.
That's right.
If their long-term goal is to go into that, leadership, CNO type of career path.
That's right. And they can totally present that as evidence. And not only just listing out, because they're aware of that. They saw that on your resume that you've done that. But that's where you can also bring in some of those points in the storytelling aspect of saying, yes, I did this. And these are some things that I was able to accomplish while I was there.
I'm glad you brought up storytelling because we're getting into that next week. Yeah. We're going to be telling you all about the STAR method, and the S in the STAR method is storytelling, but more to come on that in our next episode. Okay, so we've covered 2 personalities so far. The last one is our wallflower, those that are a little bit more quiet, reserved. They're really good listeners. They show a lot of respect. They might be a little bit more composed or thoughtful or soft-spoken, kind of behind the scenes. But again, they're still there to help they still have chose this wonderful profession of nursing. We talked last week about how sometimes they might be overlooked in clinical, and nobody wants to hear overlooked in interview or job opportunities in the same sentence. So let's spend a little bit more time talking about our wallflowers in the interview room.
All right. Well, we already know that sometimes, our wallflower doesn't always like to make eye contact. And that automatically looks like disengagement. And there's a statistic here that 71% of employers view a lack of eye contact as disengagement. And so that automatically makes it seem like you are not wanting to be there. You are not wanting this job. You are not enthusiastic about this. And we don't want that to be the way that they are perceived. And so making good eye contact during that interview, forcing yourself to look people in the eye, even if you have to, just to show that you are actually engaged and that you want to be there.
Yeah, we're locking in.
Yep, locking
right here. We're locking in.
Yep.
And you don't need to be over enthusiastic
Right.
because that's not your personality necessarily. But just because you weren't the loudest one in the room or the first one to jump into a room doesn't mean that you still can't make your presence known in a room. And it is important to have that eye contact. And we know that you're probably a really good listener.
Yeah.
So pairing your body language with your listening skills and ability is going to really make you stand out. But it's what you do next after listening and how you're presenting yourself like physically and mirroring that verbally.
Right. Make those verbal responses match what they already know about you, right? You're thoughtful. You're respectful. Let that shine through your verbal responses too. So don't just listen because you heard exactly what they asked. You heard every question. You allowed them to talk. And now when you speak, let all of those qualities that you already show shine right through that.
This is going to be hard for them because nobody likes to sit back and say, I'm thoughtful.
Right.
I'm a good listener.
Right.
Especially for this personality, if they like to kind of stay a little bit more behind the scenes, they probably don't like the spotlight on them. So saying these things, which you kind of have to say in an interview, might be a little bit more difficult. So again, going back, we'll get into this more next week, but to the storytelling part of it, use, watch and ask language. Show that you learn by listening, but also by asking smart questions. Emphasize safety. You can tell a story that shows like your level of respect and trust and care with a patient, because we know that respect and visibility equals trust in the patient's eyes.
Right. And speaking of storytelling and, having a story, is maybe you want to do a little work on the front end. And you might have to, especially as a wallflower, you may have to spend a little bit more time on the front end prepping for your interview than the bold beginner or the golden retriever may have to. And so just to help out here, there's some categories that we can fall in with these stories. And so the first one is a patient interaction. What patient interaction did you have where you displayed the respect, where you displayed the thoughtfulness? So that way you don't just have to sit there and say, I'm thoughtful and I'm respectful. Another one is a challenge that you overcame. What happened during clinical that was difficult? What happened during this interaction that might have been a little bit hard? And not only that, how did you overcome it? Okay, step by step. Right, and then another one is a good teamwork moment. Because sometimes, as the wallflower, you are being respectful and a little bit out of the way, but you want to show that you're a really good team player as well. And so you know when to step into those moments and work with other people. So give them an example of when you showed great teamwork.
Those are all really helpful. And it's always okay to have your homework done ahead of time and to prepare. We're going to get into the prep side of that next week to give you guys some tips on how to prepare, but more importantly, how to prepare out loud in practice. When it comes to the teamwork side, what teams can we see wallflowers being a part of?
And so Wallflower doesn't mean that you just stand back and do nothing, right? And so sometimes we have to think about the positive aspects of the wallflower, that caring and respectful nature that they have. And so when I think about certain areas that demand more respect, demand more care, I'm thinking about places like oncology, hospice, palliative care. Okay, those are areas that wallflower can absolutely shine. They take into consideration, and they're such a good listener, and they listen to the things that the patient is saying, and they provide just that next level of care that these clients need.
Yeah. When it comes to the families too, I think that kind of steady presence, that calmness, that aura that they bring in, is important. We had a wallflower nurse when we had a family member who was in the oncology unit and needed a little bit more assistance. And we really appreciated that nurse and the personality that they had, because you could tell it's like their heart was breaking with us.
That's right.
But they had to do that room after room after room, day after day after day, shift after shift after shift. And that takes a really, really special person.
It does. It does. And so I think paired with that is another area that just demands an additional layer of care, which is mental health.
Yes.
And so, I can see a wallflower nurse shining greatly. Great listener. Mm-hmm. They've taken in everything before they speak. They're so thoughtful and respectful because, again, that confidentiality, everybody deserves that, but especially it's got to be there in mental health. And they do that. They take that into consideration. So that's another good area for them too. And since we were talking about certain branches of nursing that typically get overlooked, I think the wallflower is perfect for these next two. Research.
Nursing research.
Nursing research. Yeah. And it's necessary. There's research in everything pretty much that we do. That's where some of this evidence-based practice comes from. And so that methodical approach is perfect.
Does that typically happen in a hospital or like at an institution?
All of it.
All of it.
Okay, so it just depends on if you've got a teaching hospital, then that's a place where research is being conducted frequently. But it can also happen in certain institutions too. All right, and then another one, and we scratched the surface of this in nursing school, is informatics.
Informatics.
Yep. Or
what's informatics?
Quality improvement.
Oh, okay.
Yep.
Is that more behind the scenes?
It is.
Yeah. So precision is really going to matter.
That's right.
There.
Yep.
Well, there you have it. There's some career path opportunities for each of our three personality types. And that's not to say, let's just go out here and say it. Because you are a golden retriever right now in your nursing journey, does not mean that you have to go into peds,
that's right,
for example, or if you are a bold beginner that you have to go into the emergency room or right, oncology for a wallflower. Mm-hmm. This is just, some recommendations if you're early on thinking, okay, well, I know that I identify as X personality. Maybe think about why career path based off of how you interact with others and what drives you and what motivates you.
That's right.
All that to say, the more you know about yourself, the better you can prepare when it goes into interviewing for a job. We want to get you confident and enthusiastic and know what signals that you're putting out there to build that trust with the people that you're interviewing with and potentially will be working with for a while. So remember, your clinical personality doesn't just disappear after school. It will walk with you into any room that you go in, including the interview room.
The retriever, your enthusiasm becomes collaboration.
The bold beginner, your confidence becomes curiosity.
The wallflower, your quietness becomes a steady presence.
Because interviews aren't just about skills. They're about trust signals. And trust starts the second that you walk in. Speaking of interviews, our next episode is all about practicing out loud. We're going to cover the top questions that you should expect as a brand new nurse, how to practice them out loud, and how to best tailor your answers according to your personality strengths.
So if you're ever worried about rambling, freezing up, or even saying the wrong thing, then stick with us. We're going to help you practice your way into confidence.
Until next time, future nurses,
Current nurses,
and retired nurses, thanks for tuning in to the Nursing Navigator by Hurst Review.
Guiding you through from school to the floor, nursing news, careers, and so much more. Learning, growing, passing the test. With Nursing Navigator, you'll be your best. Nursing Navigator's here.